Thank you for joining. I wanted to take this opportunity to talk about the COVID-19 crisis in the appliance repair, how it's affecting the appliance repair industry. And I will start with introductions. We have Bob Dougherty from Fleet Appliance. We have Scott McConnell from Lake Appliance, Christina Kraker from Servicers Web, AJ James from Pegasus Appliance, Jeff Guinn with Gwinco Service, Thomas Kissane with Tiger Mechanical, Don Harris with Appliance Service Secrets, right? And Brannon Harris with Dependable Appliance, Reliable Appliance, sorry. Wait, what is it?
Dependable.
Dependable. I always say those backwards. I always do. So I'd like for us to get started. I'll start you with Scott. Scott, how is the COVID-19 affecting your business and your practices and your technicians in Sacramento?
Well, we're definitely being affected. You know, we lost about 25% of our workforce decided to go into quarantine. Technicians who had elderly and were maybe had high risk people. We lost a bit of workforce, but at the same time, the workload actually took a real dip here in California. It's slowly coming back, but the paranoia is still increasing here in California as far as the coronavirus.
Do you know when it's expected to peak there in Sacramento?
Yeah, they're saying that the curve is flattening. They're saying that it's flattening at the moment. Mm-hmm. But we are fully expecting a second wave, just like I did hear that they're getting a second wave in some parts where they've already gone through the flattening of the curve. So we're bracing for that. You know, we're not taking this thing for granted, but at all.
Have you had many technicians that they're asking, you know, to take time off or to not work, or have you had any technicians get sick and have to be quarantined? And how did you handle, you know, those situations? There's a pause.
Yeah, we've had a few guys. So you know, the way we're handling that as a business, obviously we're pulling the vans back, we're parking those up because we don't know the length. And this is to go for, you know, turning insurances down, so we're not, you know, spending money that we don't need to spend. As far as personal protection equipment, we did a big pull early on. We assembled a team, and we were kind of, when product went down to 1s and 2s per person, that's when we had to assemble a team, and we just charged around the city of Sacramento, and we asked the guys up in Reno to go and do that as well, to pick up gloves, shoe covers, hand sanitizer, soap. You know, soap has not been a problem to find, but you know, the personal protective equipment, we had to really lean on a lot of people to get a lot of that stuff. So we're trying to stay on top of it. We have reached out to a few of our business partners that are national business partners, and just asking them for stuff, and you know, they've been really, really responsive. You know, so keeping everyone in masks. We've got a lot of people making masks for us.
Okay, I think it's cutting out a little bit. All right, well, thank you, Scott. I think we're going to move on to our next speaker, and then we'll come back to you for some follow-up questions. Next, we'll go to you, Jeff Guinn with Gwinco. Could you tell us a little bit about what you're doing at Gwinco to monitor the COVID virus and monitor your employees and your customers?
Yeah, we kind of the same thing everybody else is doing. We're asking the main questions. I know Whirlpool was working with OSHA, and they had their 3 questions. We added another question this past week on have they traveled to the tri-state area of Connecticut, New York, and can't remember the other one, but we are having the technicians check their temperatures each day for pass fail to make sure, and we're logging that so that we have that, and we're letting the customers know that we're going to those links. I actually brought them all in groups, small groups, so that we kept the less than 10 and had a medical professional come in and do some training on the PPE, discussing what's available, what's not available. She kind of went into actually the benefits of wearing the masks and gloves and how the medical community does it, and kind of driving home the point that, quite frankly, it's probably not needed in the home anyway. If you're washing your hands and doing everything other than the face covering, that's more of a education piece. So we taught them on that, allowed them to ask questions. A lot of them was wondering why we wasn't providing N95 masks and gloves and things. So having a professional come in and explain to them that, number one, it's not needed. Even the medical community is only using it when they're actually doing breathing treatments and things like that. So that kind of helped them discuss the gloves. If you are going to wear gloves, how to don them and don't them, and the fact is that unless you're taking them off on pretty much every step, that they're not doing you any good, because you still need to wash your hands. So that was good for an awareness piece. And then we went into we're pretty strict with our customers. We're not doing the customers always right game right now. It's more they play by our rules, or we don't go. And so far we've been very fortunate. I've got one technician that's he and I talked, and his wife is very susceptible, so we decided to make arrangements for him to step out. But everybody else, everybody's going, so we've been very fortunate here.
Have you seen much difference between your different locations? Because I know you have several areas you cover, but over 3 different states. Have you seen much of a difference between the 3? And can you tell everyone where they are?
Well, we're our main branch, of course, is North Texas, and then Oklahoma, and then in Phoenix, and now Kansas. And they're pretty similar, just because of the remote locations compared to the port cities in the coast. So I'm seeing pretty similar. Even actually Arizona has been we've been busier than normal out there, but we're still growing. We're kind of small out there still compared to other folks. But right now it's all of our markets have been very fortunate.
Okay, well, thank you. We're going to move on, but we'll come back with more questions. I'd like to move on to Brannon Harris with Dependable Appliance Repair. How is it? And you're in Atlanta, so how are things in Atlanta, Brannon?
We're kind of like everybody else. You're going to have a percentage of customers that, unless they have to get it done, they're not going to get it fixed. So, even on the heating and air side, people are not wanting us in the home unless we have to come in the home. It's the same thing on the appliance side. It's some of them are cautious because they feel like we're going to bring something into the home with us. But we're taking the same measurements. We got the masks, we got the gloves, the hand sanitizer. We've actually carrying the cleaner and wiping the area down before we work on it, after we work on it, and everything else as well. But it's the volume is down about 30%. As I'm sure it probably is about the same across the nation.
Do you have a lot of people that just cancel last minute and reschedule, or are they just kind of canceling? Do you think they're canceling because of they can't afford it, or is it more they're just taking precautions and not wanting people in the house?
I think it's more of a precaution at this point. We are having some people schedule a week out, and then as we get a day or 2 out, then they're hoping that it's just going to go away overnight, and obviously, that's just not going to happen. So, some people are saying, okay, we'll call you back when we're ready.
Mm-hmm.
this point, it's not. It hasn't been a money issue. It's been a we don't know what's going to happen next issue. Where this is going, in that sort of case.
When do you know when you're expecting to kind of peak in Atlanta? Have they said any?
There was a report yesterday that they had said that I'm going to say the peak is probably going to be next week. Is what they're looking at. The governor's saying the worst is yet to come. So I'm thinking probably in next week or maybe even the week after.
Are you using the masks and hand sanitizers or anything like that, or just mainly the encouraging to wash hands and keep distance?
Wash hands, keep distance, and we are providing the masks for the technician.
Where are they? How often are they changing the masks? Are they the cloth masks, or are they?
I've got some cloth masks being made, but I don't have them yet. We're just using the disposable masks, and we have some cleaner that when they get back to the truck, they can, hang it up, spray it with the cleaner, and that way we can try to reuse the same mask a couple more times, and we just let it dry out after it's being sprayed.
Where did you find your masks? I know that's kind of part of, a lot of these masks are being used for the healthcare community, and appliance repair is an essential business, but I know a lot of the masks are being sent to hospitals and clinics. So has it been difficult to find them?
It has in the regular stores, but it's good to know different people in different areas. So it's actually a friend from church that does like a secondhand store, and he gets kind of some leftover stuff or damaged pallets. I think it came off of a pallet that was damaged, and we got a box, obviously multiple boxes that were unopened, and we're able to get them through just a friend.
Good to know. Okay, well, thank you. We're going to move on to Tom Kissane, but we'll come back for more questions for you, Brannon. It's nice. That's very nice, Jeff. Thank you for using your mask appropriately. We're going to move on to Tom Kissane out of Phoenix. Hi, Tom.
Hey, can you hear me?
I can.
Right down now, we were down about 30% off normal about 3-4 weeks ago. I turned on some pay-per-click, and that has got up about 20% of that. So we're down about 12 to 15%. There was a couple of days it was slow, but it's gone back up to almost normal. We're doing the sanitizers. I've gotten the gloves from Restaurant Depot, the nitrile gloves, and I was buying by the case, and we're using that. I'm also using ice machine sanitizer as a sanitizing solution, and that works great. All the technicians have that. We give them about a quart every time they need a new quart. As the masks, I'm having a hard time getting them. I ordered a couple hundred last week. We're still waiting for them to come in. We also ordered some custom ones from Reviware, which are like a neck one that goes over your face, and that they want you put a pad in there for it's more filtration in it. What else? The guys are happy what we're doing, the steps we're taking. We actually I bought a couple of gallons of sanitizer, not sanitizer, but the Prel, and before this happened, and I broke it down to small bottles to give out to the technicians. What else do we do? We're doing everything we can. We actually created distancing in the office. 3 of the girls in the Philippines started working from home about 3 weeks ago. One of the girls, our biller, was working from home now. Our head CSR is working from home, but that's for 2 weeks now, but we're bringing her back because we're losing, too many things are falling between the cracks. She's not in the thick of the dispatch area. What else are we doing? One of the girls in the office, we moved her out to the warehouse so she can be socially distanced by herself out there. So we're doing all the steps we can do. Some of the technicians were We heard some rumor of the guys were not happy. We're not doing the same thing for the guys as we were doing the girls, but we're doing everything we can. And in the end, we found out it was a rumor being spread.
Oh, really? Okay.
Yes. Some people were stirring the pot.
Oh. Well, what is the COVID-19 situation in your area? Does it seem to
I
be?
think we're at 4,300 cases and 300 dead. And it is coming down. We're at 7%, I believe, right now, growth rate. We're doing better than, we're number 25 out of the 50 states.
Okay. Okay, well, thank you, Tom. We'll come back with in our question answer. And if you're watching from online, please feel free to submit questions through the Q&A tab at the bottom, and we'll get to those after everyone has an opportunity to speak here. So please go ahead and submit those, and everyone can see them, and we will get to those. So moving on to AJ James with Pegasus Appliance here in Fort Worth, Dallas, Texas. Hi, AJ.
Howdy, Heather.
So AJ has, how many technicians do you have? You have a little bit smaller of a group. So do you think it's a little bit more difficult having a smaller team, or I guess you wouldn't know because you don't have a big team,
Well, it's a mix of a blessing and a curse in that the day this kind of started hitting real life here was just shortly after I hired my fourth tech. Our call volume has been going up. Our COD went up dramatically, actually. The warranty side of things went down a little bit. Third party went down a little bit. But then I've also been hit with some of the actual sicknesses. One of my technicians thought he had the COVID-19. Thankfully, it turned out to be just strep throat. So we got him back up and running fairly quickly. I've got another technician. As soon as that guy got back, another one went down. We tested him. I had to pay to have him tested $259 for the drive-through testing. That was on the 7th, and we're still waiting for the results. So he's out until we can get a doctor's note, to clear him to come back. So it's basically been running with 2 guys and a trainee. So it's had its challenges. I'm not going to complain. We're working. It's good to be considered essential. My guys started off the bat. Thankfully, one of my guys is a little paranoid. And when this stuff started happening on the cruise ships and a long time ago, he kind of freaked out, which at first I didn't take it too seriously. Then I started, thankfully, reading into it. I got over to Home Depot and Harbor Freight and bought a ton of masks, gloves. But we've also, and since then we had a meeting to further understand what the actual necessity of those are. I don't want my guys relying on them. We have protocol where when we get there, we wash our hands. When we leave, we wash our hands. During the repairs, we do wash the hands. All technicians are asked, or all the customers are asked to stay at least 10 feet away. If not, just stay in the other room. We send a lot of text messages out to our customers once they first start. Once we set up a call with them, we send out a protocol of all the different protocols that we do, asking them to help us stay safe, help them stay safe. Then the night before, another text message goes out telling them when we're going to be there, and then again reiterating all the process and procedures. We really the first couple weeks was a little difficult because it was just new. Now that it's the new norm, we haven't had any problems. Customers have actually been very good. I've also empowered my technicians to, they're the first line of defense. They're there in front of the customer. If they feel anything's off, we had one of our technicians that the week before the customer kind of hinted at some things. And so I kind of let him make the call, and we didn't go back the second time. And actually the customer understood. So we're taking all those customers, instead of canceling or just putting them in we're putting them into a COVID bucket. So they have the opportunity to call us back when they're ready for us to come back, or we've got them, if we don't hear back from them, we can call them back. My techs have been really good with it. The customers have been actually really great. We haven't had too many issues. And thankfully, because of the paranoid technician, I was able to get a little ahead of this and kind of be prepared. But my guys are doing well, and I'm praying that my one guy doesn't have COVID-19, and he might be back next week.
Thank you. Yeah, I tried to buy hand sanitizer a month or so ago, and there's none to be found anywhere. It just came last Saturday, but it's hard to find some of these items. You have to really search.
Yep.
Yeah. Okay, thank you, AJ. We're going to move on here. Next, we have Bob Dougherty from New York. Hi, Bob.
Hi, Heather.
So, Bob, tell us your situation. You have a story to tell here. You're in your cabin here.
Oh yeah. My backdrop is actually I'm sitting in the living room of my 36-foot trailer in the back of my house. So I was exposed to my sister and contracted the virus, and today is day 17. I never had to go to the hospital. I didn't have breathing problems, so thank God for that.
Yeah.
But it literally felt like somebody beat me up with a baseball bat. And I'm still kind of, just not feeling right. I'm going back tomorrow to work and, still sort of just feel like drained a little bit, So could imagine with somebody who had the full force of that, what they must be going through. And, obviously the worst ones are, really bad. But, so that's where I'm at. So prior to me contracting it, we were obviously doing the same thing you guys were doing. And, when it was time to buy masks and gloves and all that, everybody was out. So we didn't have nothing. So we had to get a hold of just people that we knew locally. And we got the word, hey, shipment coming in tomorrow. First thing in the morning, my guys line up at the door and just one at a time what their limits for each van. So that's how we kind of like got ahead of the game with that. We also use a mixture of chlorine with water. As a sanitizer. That's the spray sanitizer for surfaces. And that's a lot of this information I got was off the cdc.gov website.
Okay.
I mean, I literally combed through those pages, hundreds of times, just trying to make sure that my guys were safe and doing the right thing. They don't want us wearing the N95 mask. New York got hit really hard.
Right.
My county alone, just my one county, not anywhere else in New York State, I think we got 20,000 positives and like 800 deaths or something like that. So my county is also popular for people from the city coming back out here to their summer homes. So I'm sure that probably helped, bring it out here too as well. But yeah, so we're just trying to follow protocol. We don't use the N95s. The N95s don't really work anyway. They got to be fitted and tested with like some sort of a hood with some vaping smells or something. So we go strictly with cloth. Some of the guys are using the N95s. They got a hold of some of them. But I recommend using a cloth mask. I have one right here that somebody actually made for us.
Okay, nice.
And, it just pops open, fits over your face.
Do they get hot? Do the masks, do they get wet and hot throughout the day, or do they?
Yeah, they do. So, you have a couple of the cloth ones, and then what you do is at the end of the day, our technicians leave their shoes in the garage. They take all their clothes off, including the mask. They go right into the washing machine, and they go directly into the shower. So we're making sure that they're not bringing anything into the house. So I spent multiple meetings and hours just going over protocols. Wash your hands when you get in the house. Wash your hands when you get out. That's the most important thing. That's what breaks down the cell and it kills the virus. You could use hand sanitizer all day long, but soap and water is the best thing to use. So the safety was the first thing. And we were cranking right along, and about 2 weeks ago, we had a little bit of a drop. And then last week, the floor just fell out. So my guys are on unemployment right now. We're probably down about 60% of the volume that we normally do. And right now everybody's scared because we don't even know if we hit the peak. They say this might be the peak right now. So, but the numbers aren't changing. They're sort of just staying level. The same amount of people are dying and just a little bit less people are going into the hospital. So we're not even sure what's going on. And they just extended New York State stay at home until May 16th now. you know. So I know other states are probably going to open up. They probably didn't see the, you know, the as much volume as we had with that. So
Right. Well, no, New York's been hit very hard with the COVID-19.
yeah.
So you, how many technicians do you have?
6 total.
6 total, normal, and
Yeah.
so volume's down. Okay,
Yeah.
well, thank you for joining, and we hope you feel better. When you're going back to work tomorrow, is that right?
Yeah, I feel good. I'm just a little tired though, you know. So we'll
Yeah.
see. I'm sure I'll be fine.
Okay, well, don't
But
overdo
thank
it.
you.
All right, thank you. Okay, we're going to move on to Christina Kraker with Servicers Webs. Christina, could you tell us a little bit about what your company does and your experience through this COVID-19 crisis?
Yeah, so we manage the digital marketing for about 40 appliance repair companies across the U.S. and Canada. So we're seeing kind of a really wide perspective of what's going on across the country in terms of, you know, call volume and impression data. Overall, we're seeing a drop in impression data, meaning less people are searching for repair right now than it's typical for this time of year. So obviously that's affecting everyone because there's less calls available for everyone to share. Having our clients that have like a stronger, more diverse web presence are faring a little bit better than people who maybe have a really poor online reputation, you know, because people are calling around right now and they're really shopping service. We've increased our efforts as far as like listening to the calls that we record that come from, you know, paid advertising and organic traffic, just to get a better gauge on consumer behavior. We're seeing a lot larger percentage of people requesting estimates over the phone because people are being really price cautious right now. Mm-hmm. They want to know, how much is this going to probably cost if I have to repair it? Whereas in the past, you would have, you know, a few people asking those questions, but for the most part, they're, you know, comfortable paying your fee to come out. So, you know, we're just trying to talk to people about, hey, if you're listening to your phone calls and you're noticing, or your CSRs are noticing a lot of people requesting estimates, be prepared to be a little bit more competitive by, you know, helping consumers understand your pricing models before you come out. We're seeing a lot of companies that are getting a lot of lead volume, but they're, you know, booking out 3 or 4 days because they are so busy, and consumers calling and canceling because people are wanting, you know, like really quick service now. So our clients that are taking same and next day service seem to have less cancellations. So that's a pretty typical trend right now that we're seeing. But yeah, it's been like the longest winter ever. Usually around this time of year, we start seeing everyone's schedules fill up and everyone's really like starting to get busier, and it just feels like we're heading back down into the slow season. So seems like for the most part, people are, you know, staying, their schedules seem to be okay, but they're definitely seeing drops in calls. Mm-hmm.
Okay, well, thank you for that. I'm sure we'll have some follow-up questions from the audience or from the panel here. But you're in Sacramento, right?
Yeah, we're in Sacramento.
Okay. Very close to Lake Appliance.
Yep.
Okay, next I'd like to hear from Don Harris with Appliance Secret Servicers. Don, it's my understanding you're very involved with the peer groups, and you've been on a lot of various calls with a lot of peer groups over the last 6 weeks or so. What has been your experience with the peer groups, and how does someone get involved in a peer group if they're not currently involved?
Okay. So I run 4 Mastermind peer groups, 2 in the HVAC side of the business and 2 in appliance repair. And so the groups are anywhere from about 6 to 10 members total. So we do weekly calls. And so I'm talking to 30 to 40 people on a weekly basis. And really for the past 4 weeks or so, it's been all about this coronavirus, the COVID-19 stuff that's going on. We've been looking and discussing the economic injury disaster loan and the PPP loan. We're encouraging the members to go ahead and apply for those. Some of them have received the loans already, probably maybe 20% of them. The others are still waiting. And one of the biggest things we've been talking about over the last 2 weeks is I've been encouraging them to watch their cash flow, because during this crisis, cash is going to be king. If you run out of cash, you're out of business. So I've been encouraging them to watch that cash. I put together a cash flow template and worksheet that's available on the website. They have it, and I've encouraged them to use it on a daily basis so they know whether their cash flow is positive or negative. And so if they see a negative cash flow pattern, then they better kick things in gear and see what can happen. I've encouraged them to look at their expenses, see what they can cut or curtail for the next 3 to 6 months. And when it comes to revenue, see what you can do on the revenue side. Can you train your techs to maybe do some more upselling, encouraging them to get that second appliance repair or that service agreement that you can sell if you're an HVAC company, or even with an appliance company, a service agreement, or discounted or free checkouts of other appliances. Just anything to kind of build your revenue a little bit. Small dollars are going to make a big difference in this type situation. What I'm seeing with most companies, there's a handful where their businesses have increased. I got one appliance guy that does service and used appliance sales. His used appliance sales have skyrocketed for whatever reason. His service is steady, but his used appliance sales have skyrocketed. I've got another appliance and HVAC company in Myrtle Beach. They're almost dead. They sell new appliances, and most of their business comes from the homeowners or the owners of homes or condominiums that they rent out to people, and they can't rent them now. So their population is typically around 20 to 30,000. And in the summer, it skyrockets to 500,000 people. So they're, they really depend on that summer traffic. So they're pretty much dead. So it really depends on region more so than anything else that I can tell. But overall, the majority of them are down a little bit. Other than that one that's almost totally dead. But they are experiencing a slowdown. So that's why I'm encouraging them to get that cash flow calculator and start using it on a daily basis. Anyone can download it if they go to applianceservicesecrets.com. When you get to that page, kind of to the right-hand side a little bit, you'll see free cash flow worksheet. So you can click on there and download it to use however you feel is appropriate for you. It asks you those questions about your expenses and your revenue. It talks about your cash flow on a daily basis, and then your accounts receivable. Accounts receivable is something that can be critical in this time. If you can lower your accounts receivable and collect some of that stuff, it's going to go straight to the bottom line and help pay some of those expenses that you may be incurring. So work on your accounts receivable, and it has a little tab for accounts payable. You certainly want to eliminate as many accounts payable as you can, or reduce those. Work with your vendors to see if you can push the payments out a little, or maybe even get a discount. There's a lot of things that you can do in that area right there. If they're looking to join the Mastermind group, again, when they go to the website, there's right in the center of a page, there's a link to the Mastermind group page, and there's information on there how they can join a Mastermind group. Contact me and we can talk about it.
How many groups do you have currently?
4 total.
So how would someone contact? So can you tell us what a peer group actually does, or how many people are in the group, and how you?
So there's different peer groups out there. Some of them will meet once a year. Some of them meet 3 or 4 times a year. I think the one at USASA, I think they're meeting on a monthly basis now.
Mhm.
We've decided probably a couple of years ago that we needed to meet on a weekly basis. And especially during times like this, I really, it gives everyone a feeling of support. There's somebody out there that's experiencing the same struggles and situations that you go through. And face it, your employees don't know how much stress you take on as a business owner. But when you got 6 or 8 or 10 other business owners around on a call talking about what they're struggling with, or talking about the issues of getting the PPP paperwork filled out or dealing with the banks, it just gives them a little relief that they're not in this boat all alone. And so what's said in the group stays in the group. It's confidential conversations. And so we're really just there to support each other. And it's not just you sitting in your office all by yourself trying to figure this thing out. You can come to this meeting and you can throw out anything that you may be struggling with. And there's 6 or 8 or 10 other people around there that is either gone through what you're going through, is going through what you're going through, and they can help you tell you how they got through it and what they had to do, or how they dealt with it.
And those are matched up. You match these groups up based on company size or geographic location, or just?
It's a combination of both. They can't be in competing markets, so they're spread out all over the country. We do try to group them by size. There's some larger companies and smaller companies, but we can't always do that depending on what kind of people we're having that's wanting to join. So we try to group them together as best we can.
Okay. So if did you give your contact information if someone wants to reach out to you?
Yeah, they can
contact me and I can.
Right. They can email me at don@applianceservicesecrets.com, or they can go to the website applianceservicesecrets.com and look around there for information, download that cash flow template, and there's a link in there that if they're interested in joining a peer group, they can send me an email.
Okay. Looks like Christina sent it out in the chat feature on the webinar here. So everyone should have that. So I just had a couple of questions for the group. How many people have applied for the loans that have been offered for small businesses? And how many people have been funded already? And no one's been funded. Okay. Jeff, would you like to elaborate?
Well, it's pretty confusing right now. A lot of banks are, I'm also part of a peer group, and some of our peer members have been funded, I believe funded, or they've gotten their numbers. We got our SBA number, which apparently means we've got it, but the banks are, apparently some of the bigger banks are a lot of confusion going around. So we've been hearing back and forth. So there's a lot of, in the early stages, it's a little confusing, but I'm hearing more and more each day. I'm hearing that they're getting the money.
Well, I know today, so I previously had my CPA was going to come on and kind of discuss the different loans, but then the loan applications were shut off this morning. I've heard from a banker that they may open back up, but if people haven't applied, I think there's a hold on any new applications right now. Unfortunately, yeah. Yeah,
they shut it down for new loans. If you're trying now, it's a little late, but you can still, I think you can get, you might want to get in line. If you haven't done it, you might want to reach out, because if they release more money down the line, then you want to be in the front of the line.
I just wanted to also mention the UASA also has peer groups. So I know a lot of members here are members of the it's not USA, it's UASA peer groups now, and I've really benefited from those. So if someone wants to get involved with that, who's the best person they should contact for something like that? Tom, you want to take that question? Tom or Scott or Bob, anyone? Jeff? Brannon?
Here.
Yeah,
It's, go ahead,
go ahead.
Scott?
Okay, yeah, I believe it's Fred.
Holbrook?
Fred Holbrook, Sloan Appliance is running that. He's on the board of directors at the UASA, so I don't have his info, but maybe I'm sure Christina could. There it is. Okay.
Yeah, I just popped that in the chat.
You're a great multitasker. Yeah, so Fred is the guy who's managing over at the United Appliance Services Association. With the help of a couple of others, there's a committee formed. So
I believe Christine would probably know that there's a web link where you could click on their website, unitedservicers.com, and they could just fill out the form right online, I think.
Yeah, I just put that link in the chat box, so it goes straight to the form that you need to fill out.
Sarah's watching this right now.
Oh, okay. So Sarah, you can also reach out to Sarah Brown or you can, yeah, so do you have Sarah's contact information? Christina, could you push that through? Thank you.
Yes.
Yeah, these are really helpful to a lot of business owners. What other questions do we have? So we can look at the Q&A here. We have a technician that tested positive and has been in the hospital for 2 weeks. We have been covering his salary for a month now. What are other companies doing for techs who are sick, for this issue? What about techs that are choosing not to work out of fear for the virus? Who would like to answer that question?
I'll start.
Okay.
It's Brannon Harris. So we've had a couple techs that are kind of scared about what's going to happen, and if they have opted out at this point to not work, and there's really no reason for them to stay home, like they don't have a small child, or they're not taking care of a family member or anything like that that's already sick, then at that point we have decided, there's no recourse. So at this point, we've decided to not pay them at this time. We still hold their position and their job open for them. They can keep the vehicle at their house and everything until they feel comfortable. But as far as anybody else, I have had a couple techs that have had symptoms, and at that point, we're following the guidelines where they got to quarantine. And at that point, that they do get, they get their pay, because we are getting reimbursed on the tax credit end through the government. So that's how we're kind of handling that. And, it hadn't been a whole lot of people, but it's been a couple guys that we've done with that.
Because the payroll, the loan doesn't necessarily cover, all the payroll, correct? It's partial.
Well, you got so many different grants and loans out right now and different things. The PPP loan, now that doesn't really go into effect until you've been funded. And at that point, they're wanting, even if somebody's got the time off, then at that point, the government wants you to pay them. And what we're looking at is a minimum of at least 32 hours if they're taking time off. But we haven't been funded, so therefore, I can't really use that. I think there's one of the FMLA acts where, like I said, if they have a small child and you can't handle daycare and they've got to take 2 weeks off, then they're going to get paid for that, and we get a credit on our taxes immediately for that payroll. Same thing if they're taking care of an elderly person or something like that. So that's how we're handling that as of right now.
Okay. I'm going to go to Jeff.
Yeah, you got the CARES Act so you've got So anyone that's related, they're actually, it's related or unrelated. So if they're related to the COVID, whether it's the and it's pretty flexible. You might want to get with your HR specialist because there is a lot of leeway on that, but you can pay them up to 2 weeks full pay if it's actually related or healthcare or they're sick or quarantine. If it's unrelated, they get 2/3 pay. They can stay on your payroll, and you got up to 2 months. So they could get up to 2 weeks and then another 2 months after that of full pay for the 2 weeks and then 2/3 pay for the following 2 months. So if you've got someone that's sick or close or someone in their family that's sick, there's quite a flexibility. So if you've got a specialist, reach out to them to help them out.
Okay.
It's the Family Cares Act or the CARES Act if you want to look it up.
Okay. Scott, we were talking earlier. You mentioned your company's doing some sort of financing now. You had a lot of talk about your check issue and some of the things we kind of discussed offline. So I thought it was pretty interesting.
Yeah, we found that quite interesting, and we thought it was a glitch. I believe it was late February, early March. We started noticing we had a massive influx of bounced checks and people putting stop payments on their checks. They would write us a check, stop payment. So, once we verified that those were all actually accurate and people were holding on to their money, we realized, we're going to be the ones left holding the baby here if we don't make a decision. So we immediately stopped taking checks, and we're asking 100% for credit cards or cash. And then just in kind of monitoring our phones over the past 2 weeks, we've noticed that people are being very honest, saying, hey, I'm a restaurant worker, or I was a server at a bar, or whatever their job was, that was basically one of the first jobs to be shut down. And they're being open and honest and saying, I don't have any money, but my fridge doesn't work. What can you do for me? So we reached out to Christina or she reached out to us, one of the two, but we have set up financing, which we haven't implemented just yet. We've been educating ourselves on it now. We got it set up. It's through PayPal. So I think, Christina could probably help out with that if anybody wants to set up financing. And then what we're going to do to get in front of it is just say, hey, to our customers who are collect customers, would you like financing? Would you like us to set up financing at this point so that you can hold on to any cash you have? Because, that seems to be an issue that I think is going to get worse before it gets better.
So then the customer has to apply for the PayPal credit, because I've kind of gone through this with our academy as well, trying to offer financing that way. But they have to. Is that the same kind of situation?
Yeah.
Get the PayPal credit and.
Yeah, I'm getting a couple of notes here from my wife at the bottom of the page, but it's something like an instant credit there that like I said, we haven't fully got it implemented yet. But we're right now setting it up. So as soon as I have better information on that and we actually put a few customers through the process, we want it to be nice and easy. I don't want my technicians to have to be dealing with it in the home because they're there to fix appliances, not run people's credit or any of that sort of stuff. So that's just something that we're looking forward to. And it goes back to Don's comment about cash flow. That was one thing that we started to panic about immediately, was cash flow. So definitely look at your revenue, look at your expenses. The vehicles that we have parked up, we just parked them up in a fenced yard, 7 vehicles. We contacted our insurance company and said, hey, these vehicles are now going off the road. So just trying to save the company as much money as possible right now.
Yes. Okay. Well, thank you for that.
Mm-hmm.
Crystal has a question here. Have you already submitted a payroll with the emergency sick pay for one or more employees and received an instant reduction or instant credit? Does anyone?
Yes, we have.
Oh, okay.
Our last payroll we did, but we use a payroll company called Gusto, and it's all strictly online, and they kind of got ahead of this thing or was jumping on it pretty quick. So they have their formulas already in line to where, they labeled it COVID-19. So if the person they got their full pay, and you just click next to them if they were labeled as COVID-19, and we instantly got our credit right then and there off our taxes.
Oh, wow. What company do you use for that?
Gusto. They're a payroll and HR strictly online company, and it's very nice to use.
Okay.
Yeah, we also had the same thing. This payroll went straight through, and it's coming out of your payroll taxes. So basically, if you don't know, if you owe 1,000 or say 5,000 in payroll taxes, if you have 2,000 in qualified COVID days off, then instead of paying you take 2,000 off your payroll taxes and just pay the 3,000 balance. So you're not out any money at all. The only time it would be a problem is if it goes over your payroll taxes, but that's instant. And again, there's all kinds of payroll systems out there. We use Paycom, but 80, there's countless. But if you have a payroll system, if you don't, reach out to your accountant, because it's straightforward. It's easy. It's no money out of your pocket. And it takes care of you people so that they can take that time off, especially if they think they're sick.
Okay. Thank you for that. Does anyone have any questions to ask one another on the panel? I know we were supposed to maybe go to the MFA meeting that was canceled this year. Hopefully it'll be rescheduled later this year, along with the PSA meeting is also coming up, I think in September as well. So hopefully there'll be another opportunity to get together. But what kind of questions do you have, if any, for one another?
I have a question for the group. We're big on, team building here and morale, and we've done a couple of things, but has anybody done anything team building wise to pull their people together and lift up spirits and try and keep everybody feeling engaged and happy about the current times?
No one's. Yeah.
Tell them I'm thankful I don't live in California. So.
So I had a little bit of an issue with the guys, and there was a little bit of a disconnect. I didn't want to meet in a group setting, so we sort of used Zoom. And for the first couple of weeks, we were meeting, maybe once a day, once on the weekend, just to recoup and what we're going to do for Monday. I really had to drive into them that we are an essential service and that the people that are on the front lines depend on us. So they have clean clothing and, safe, sterilized dishes and whatnot, and that sort of worked for me. So I know I'm a smaller crew than you got going there, Scott, but, maybe a couple of, a few guys at a time, and just have a pep talk with them and just try to let them know that they're important and we need them. They can't be home. If they can work and they can pay their mortgage, then they should be doing that, to help everybody. Who's got to put their little part in it,
Yeah, that's good info. Thanks, Bob.
I think the biggest thing right now is to communicate, over communicate. The thing that I've noticed with my group is that we assume that they know, and they're reading some of the, we talked about going on the CDC and getting the accurate information. And I hope that most people on here are doing that. If you're not, please do so. But our team, don't assume that they're doing the same thing. They are on Facebook. They're on social media. They're reading some of these news articles, and they're scared to death. So staying in front of them, talking to them, letting them have that open door policy where they can call and talk through things. I had a technician last week reach out to me and just say he wants to take 2 weeks off just because. And, we all hear about that 2-week thing. And when I asked him what happens in 2 weeks, he didn't really have an answer. So sometimes they just need to talk through some stuff. So I think, the biggest thing right now is just make sure that they have, they get to say what they want to say, that there's no hard feelings. I've told my team if they do want to shut it down, that's fine. If they got to do it, they got to do it. Take care of your family. I'll see you on the other side of this thing. But I think communication is huge right now.
George Dempsey says that they've been doing a lot of Zoom happy hours. So I guess just kind of getting some margaritas together and getting on Zoom.
Yeah, that's a good idea. Thanks, George. We'll get that going.
I'll follow up with Jeff's comment about communication. You can't communicate too much because these guys are scared. They don't know what's going on, and they are afraid that they may lose their job. Mm-hmm. Even if you are essential, if the work's not there, it's not coming in, something's going to happen. And so, yeah, just over communicating and let them know that you're applying for that payroll protection plan, and you're going to make sure that they get paid, their weekly salary or weekly wages or average commissions or whatever it is. You're there to support them. And if they see you supporting them and giving them that kind of information, they're going to be a little more loyal to you, after this thing is all over. And they say, well, look what he did for me. Even though I didn't have to work, he still kept me, paid my 4 weeks wages, but I was only working 20 to 25 hours a week, but yet I still got my money. So that's going to be key, just to showing them that you care about them as not only an employee, but as a person and their family. So that's key. That's key.
Thank you. Thanks, Don. Uh-huh.
I'm apologizing to my guys all the time that we're not as busy as we were, and they're all saying, I'm glad I'm working, because a lot of our friends in the industry are not working. A few companies in the Valley have gone out of business. I'm seeing resumes pop up all the time now. Sears laid off 6, a few other companies went under. But my guys are saying, hey, I'm glad we're working, thanks.
Mm-hmm. There was a question, I guess you answered it, Jeff. When marking payroll, when marking someone as COVID-19 for payroll, what proof are they looking for? Did they look for proof as marking them COVID-19?
No, it's pretty much up to you to police what we've been told. There's no doctor notes needed. So it's, the thing that I've told my team is just, don't abuse it, because you only get 10 of those days and you might actually need them. We don't know when the wave, here in Texas, we don't know if the wave's going to haven't been here yet. So, we want to be stingy with them, but we were told by our payroll group that it's pretty open, pretty vague.
Hmm. Yeah, it's kind of hard to police all of it. It's just kind of, you just kind of have to go with it, right? Just kind of monitor. Yeah, but if they use more than 10 days, then it causes problems.
Right, and the thing that I want to make sure that I'm clear with everybody. I'm just going by what we were told. So it's changing daily, because everything that came out, we as we all know at this point, it was all vague early, and then they're starting to kind of tighten up. But so if you do have a payroll specialist, kind of reach out to them. Please don't take what I'm saying. I'm just going by what the last thing I was told, and that might change, might have been changed today. I don't know, but I have an HR specialist, and she is not here talking right now. So.
And I'll even add, talking about things changing, there's really nothing specific in place about the forgiveness of these PPP loans. They're saying they're going to forgive, up to 75%, or forgive up to the total amount with your payroll, your mortgages, utilities, and things like that. But there's really nothing in print that says they're going to do this. Even when you sign that loan document, they're saying that, they're not saying you're absolutely going to be forgiven. They're saying it's still in process and still being figured out. And so just make sure that if you get that PPP loan, put it to the side in a different bank account or something. Don't just assume that that's money that you can just play with. It's there for a purpose. So make sure you track it. Make sure that you document what you're using it for, if you are using it, so that you have the best chance of having it forgiven.
And it's a 2-year payback. It's 0.9%, 0.97% and 2-year payback. So you're exactly right. If you're not using it for what you need, then I would put it back because you might need to pay it back.
Yeah, here at the Dyer Academy, we have shut down our classes for the month of April. They did deem us non-essential, and then they came back and said they allowed us to be essential, but we went ahead and shut down classes anyway for the month of April. We may come back in May, the middle of May, with some online classes for the first week of the class, and see where the numbers are and go from there. But I think for all around the country, it's kind of day by day, week by week right now on how everything is going to be shaping up. But I guess we'll go ahead and close for now. Thank you everybody so much for joining. This was very helpful. If any of the participants have questions, you can reach out to me, Heather at DyerApplianceAcademy.com. I could put you in contact with any of the speakers if you don't have their information. But thanks for joining, and hopefully we can do this again. If anyone has any suggestions on what they want to talk about or hear about, yeah, feel free to reach out, and we'll see what we can do. Thanks, guys.
Thanks, Heather.
Sounds good. Thank
All
you.
right.
Thank you.
Thanks,
Heather.
Heather, for putting this
Bye,
together.
everybody.
All right, thank you. Bye-bye.